Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our Facebook Live sessions. This is a chance for me to answer your questions, and we have a few great questions today that we're going to be answering. But if you have more, please put them in the chat section and we'll get through it. What we do see, as always, we start with questions from people who put them in at Facebook questions at douglaspublichealthnetwork.org. And as always, we'll start with the situation in the world and then move down. So the situation in the world is that fourth peak is really subsiding. So throughout the world, the fourth peak is subsiding, but the situation in the world is very different depending upon where you are. In the U.S. and much of Europe, the situation is really calming. In Asia, the situation has been pretty calm all along. But in Brazil, Argentina, and Uruguay, they're having just about as worst time as they've ever had. Uruguay is now having 99 cases per 100,000 people per day. We're also seeing India just have a terrible time. I think the numbers from India are so very difficult to tell because of the overwhelming of the system. In Europe, we're still seeing a lot of disease in Lithuania and Sweden. And, you know, I've told you my big worry is that we're going to start to see more disease in Africa. And this week, we've seen an increase in disease in South Africa, Botswana, and Namibia. So we're going to check to see what goes on there. The U.S. has been remarkably quiet, only 8 cases per 100,000 per day. This is the lowest time in almost a year. And in the U.S., there are no particular hotspots, and actually some very important cool spots. So much of the center of the nation is having very low level of disease. And even New York, New Jersey, Connecticut, those areas which have had so much disease early on and then so much disease around Christmas, now are down to less than 6 cases per 100,000 per day, which is pretty amazing. If there are hotspots at all, it would be in Louisiana, Texas, Florida, and Colorado. Hard to know. In Oregon, Oregon's also slowing down. We peaked at about 20 cases per 100,000, and we're now down to about 10 cases per 100,000. But the number of hospitalizations in Oregon remain high at over 350. So we still have a lot of hospitalizations in Oregon, and some of the more critical things that hospitals do, like ECMO, extracorporeal membrane oxygen, which is that sort of artificial heart-lung machine that you use for young people, are in great shortage. We heard earlier this week there were no further ECMO beds left in Oregon. That is pretty scary. In Douglas County, we've seen a real peak in the last week. We're now at about 17 cases per 100,000. We had some of our busiest days last week, and we have a high number of hospitalizations. 19 today, and I think there are 2 more this afternoon. So 19 people in the hospital. Most of these people are younger. Many of these people are really quite sick. A couple in the ICU on a ventilator, so it's very worrisome about the high number of cases in the hospital and the level of sickness of some of those people. We look every week at our cases to see if we have breakthrough cases, that is, people who are vaccinated who had disease, and then we look at all the cases to see if they've been vaccinated. In the last 2 weeks, starting going from Friday to Thursday, we had 199 cases over the 2 weeks. So 199 cases, really a lot of cases. And in those, what we saw there were 0 fully vaccinated people. 0 fully vaccinated people. And among the vaccinated people, there were 0 cases. I mean, that is stunning. So when you talk about statistics is always very confusing, and I'm not sure I understand most of it, but you recognize the chance that this would happen by chance and not because of the vaccine is infinitesimally small. Again, when we looked all the way back, we've had a handful of breakthrough cases, a handful of hospitalizations, and a handful of breakthrough deaths. But at the same time, we've had so many more cases and people unvaccinated that it's so really very clear that the vaccine is working well. And again, to see these hospitalizations and the people in their 30s, 40s, and 50s is really heartbreaking. I mean, some of these people who are in the ICU are going to be sick for a very long time. And that is a big worry. And when we see that overwhelmingly these people have not been vaccinated, it's a little hard because we do have a really good, really safe vaccines out there, and the people who are not using the vaccines is a little bit worrisome. When we look in the world, there are a couple things which are kind of funny. One is if you look at places in the world, in general, places that have high levels of vaccination have low levels of disease. So New York, San Francisco, UK, Israel, they've really brought the vaccine rates up, and they've had very low levels of disease. But there are three places in the world that are very concerning. So the Maldives, which are these little islands in the Pacific Ocean, Uruguay, a coastal country on the east coast of South America, and Bahrain, which is in the Middle East, so three quite different countries, all have very high levels of vaccination, about where the US, the UK, and Israel are. And yet, those are three of the hottest places in the world. In Uruguay, it's all the P1 variant. In the Maldives, we think it's mostly the 617 variant. And in Bahrain, it's a combination of all three of the variants. And so the worrisome thing is looking at those three countries that have had high levels of vaccines. When one of the variants comes in, they still have relatively high levels of disease. So that's a bit of a worry. The other worry that we see is Africa. Again, remember, Africa's had very little disease. They have very little natural immunity. They've had almost no vaccination, and they've got not particularly great. Healthcare situation. So that is indeed a worry. People also have been asking about different countries in the world. Remember, early on, there was a lot of interest in Sweden because Sweden took somewhat of a different approach than Norway and Finland around it. And what we see now is, to get you the sense here. So Douglas County has per million people, so we've got 1/8 of a million people, about 30,000 cases per million, 65 deaths per million. Oregon has had 47,000 cases per million, 622 deaths, so more cases but slightly fewer deaths because we have a very much older population. In the U.S. overall, about 100,000 cases and 1,800 deaths. When you get to Finland, though, they've only had 16,000 cases and 169 deaths, but in Sweden, 104,000 cases, more than the U.S. in population, and 1,415 deaths, about 10 times the rate in Norway and Finland. So countries get to choose the way they want to do it, yet what we see on this is that they've had a lot more disease and a lot more deaths. So there's different ways to approach this. I don't think any place has done it exactly correctly. But it really is interesting to see the differences in places that are so close as Norway, Sweden, and Finland. All right, so let me get to the questions here. So Dennis says, does immunity last longer in seniors? If it's shorter, should they go to the front of the line for the upcoming variant boosters? So the first thing on the boosters is there's a lot of talk about the boosters, but as best we can tell, there's been no study and no specific plans for the boosters. So again, there's three reasons you would do boosters. One is there would be a new and better vaccine that would come out. Don't think that's going to happen. The second thing that's going to happen is because you might have waning immunity. So immunity might wane over time and you need to have a booster to bring it up. Or there could be a change in the germ so that you would need a new vaccine to deal with the new germ. So for example, in shingles, you get a booster because there's a better vaccine. Tetanus, you get it, not because the germ has changed, but because your immunity wanes. And for flu, you get a booster because both the immunity wanes and the germ changes. In this case, we clearly know the germ has changed, although it still seems to be pretty effective against most of the variants, and we think that the immunity might wane over time. I do not know what the strategy is going to be for boosters, and so we're still looking to see. Nobody's even studied any of the boosters yet, so it's a little hard to know what's going to happen with boosters. So when you do boosters, are you going to use the same vaccine? Are you going to use a different vaccine? There was actually a very interesting study today in the UK that showed that people who got AstraZeneca first and Pfizer second got the best protection in this mix and match thing. So there's just a little bit of data out there that maybe what you would do is you'd switch to a different kind of vaccine. Again, this is all chatter at this point. There's no firm studies about that. So someone says, how do I schedule a Tiger Team clinic at my workplace? So the Tiger Team is a group that we formed here in Douglas County, a group of 6 people, and they go all around the county giving vaccines to some of the most rural places in the county: Milo, Tiller, Days Creek, Camas, Azalea, and they go around and they do vaccines. They've done a great job. They've given hundreds and hundreds of vaccines so far with no troubles. We're doing this in coordination with Umpqua Valley Ambulance. They are pretty booked up, but they certainly are always anxious to go and help people. Their first priority is for people who are outside the I-5 corridor, because on the I-5 corridor, there's lots of places to get vaccine. But once you get away from the major population centers in Roseburg and Myrtle Creek and Canyonville, vaccine gets much scarce. So that's their first thing. So if you're a workplace, especially in one of those areas, we can do it for you. And if you call to the DPHN number at 541-440-3571 and talk to Mark, he can take a message about maybe having the Tiger team come to your workplace. Again, there are many, 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 many places to get vaccine and lots of vaccine out there. So the lack of vaccine and the lack of vaccine site shouldn't really be an issue, but we still want to get it. So someone says, I've gotten the vaccine, but my parents are really opposed to the vaccine. We can't even talk about it. She says, I worry because any talk of the vaccine leads to a fight, which has really frayed the relationship, especially with my mom. Do you have any advice? Well, this has been one of the most heartbreaking parts of this whole pandemic. I think early on, people might have disagreed a little bit, and you could talk with people and whatever about's going on. But I think at this point, much of this talk is immediately escalates to some downright ugly stuff, and that really is hard. So I have a dear friend who's a doc, and you know, we talk a lot. We don't usually agree on most things political, but we talk, and we talked about the vaccines, and I will tell you, this discussion really degenerated very quickly into to ugliness. And that really is heartbreaking because I know other people who say, I can't even talk about the vaccine with my parents, or I can't even talk about the vaccine with my best friend because of the disagreements here. And this is really hard because we really do need to get the number of people vaccinated up. But if you can't even talk to people about it, it gets really hard. So the question is, do I have any advice? Unfortunately, I don't have any good advice. I mean, I think it's always good to listen to people, listen to what their fears are, try and work with them on the fears. But there's a small percentage of the population that is so opposed to the vaccine that they just won't get it. And I've seen a bunch of people in the office, people who I've taken care of their kids for years and years and years, and we haven't disagreed on much, but we disagree on the vaccine, and that is really problematic. The person says, tell me about the cases of myocarditis after receiving the vaccine. So there have been a few cases, handful, we don't know the full number yet, but probably less than 20, but more than 5, of people who have myocarditis following the vaccine. So what myocarditis is inflammation of the heart. And myocarditis happens not uncommonly. I mean, it's one of those things that we see, and with it you can get chest pain, you can get some other symptoms. On laboratory analysis, sometimes a little bit of a bump in your cardiac enzymes. We see it not uncommonly in the summertime related to other viral infections. But that is a little funny because it's not that common, and now we've seen a couple of cases, mostly in younger people, mostly following the second dose of the mRNA vaccine. So it's one of those things that may well be related to the mRNA vaccine, and it's sort of a problem because we don't want anybody to have myocarditis. Now, it doesn't appear that any of the cases are very serious. It also shouldn't come as a terrible surprise because Israel reported some cases of myocarditis following the Pfizer vaccine, and myocarditis is very common following the natural infection. So although there are some cases following the vaccine, there are a lot more cases following the natural infection. So let's say there is this myocarditis associated with the vaccine. It's still probably better to get the vaccine than to get the disease, because the myocarditis with disease can be very severe, plus everything else you get with it, where it appears that the myocarditis that people are getting with the vaccine is relatively mild. Okay, another question that has come up this week is, tell me about where this virus came from and all this about the Wuhan Institute of Virology and pangolins, and where in the world did this come from? Well, I think the answer is we don't know where this came from. Coronaviruses have been around for a very long time. There are a bunch of other coronaviruses that affect humans, and some just cause mild colds. There's some kinds of coronaviruses that affect dogs, give a diarrheal illness. And there have been coronaviruses in the past. So back in 2005, there was a coronavirus that we think went from bats to civet cats, which are these little raccoony things, and then to people. And that was a beta coronavirus. That was pretty serious. It was not that contagious, and it had a few thousand cases, and then with really strict control measures, died out. Where did this one come from? It almost certainly originated in an animal, and the most likely animal that originated is bats. Bats are amazing, but one of the things, there are a few things about bats. Bats live a long time, and so unlike other small mammals, other rodents and things like that, bats, which are in a different genus, live a long time, and because they live a long time and they fly and they live in huge arrangements in caves, their immune system is adapted to not react very much to a virus. So they carry a lot of viruses. And in fact, in the U.S., in Oregon, the leading cause of rabies in Oregon is not from cats and dogs, but from bats. And we know that coronaviruses are in bats. So it's likely that this coronavirus started in bats. We then know that it spread widely among people in December in this wet market in Wuhan. So this wet market is where they sold animals. And the question is, how did it get from the bats, presumably in a cave, to people in Wuhan? And that is a mystery that I think we don't know the answer. So I'm going to give you what the various theories are and what I think about those theories. So one of the theories is that it started in a cave, got spread to a human, and then because it was sort of an illness we didn't know about, spread throughout China, and then finally wound up with somebody who was sick in Wuhan, who then spread it to a lot of people in the Wuhan market. That's totally believable, because we have a lot of respiratory disease that we don't know where it comes from. So if you looked in the hospital, say, 8 years ago, before there was COVID and whatever else, we had all kinds of people in the hospital with pneumonia, sometimes really bad pneumonia, sometimes pneumonia that killed people, and we never quite figured out what it was due to. So there are some disease you can figure out exactly what it is. So if I got a big boil, they cut it open, they send it to the lab, and they can find out what the germ is. If I got a urinary tract infection, they can do that. If you have meningitis, they tap your spinal fluid and they check that. So all of those diseases, we usually have a very good idea of what causes them. However, in pneumonia, it's really hard. This is in the lungs, and there's not really a good way to get the germs that cause the pneumonia. And so there are many cases of pneumonia where we never really get the organism. So it wouldn't be the least bit surprising that there were some of these cases percolating through China between the springtime even, and then percolating through, and then finally there were enough sick people that it then spread in Wuhan. So that's a possibility. The second possibility is that there's somebody from the Wuhan lab, so it's the Wuhan Institute of Virology, and one of the jobs that they do is they collect samples, and one of the places they collect samples from is bats. So one of the possibilities, I think, is that somebody working at this lab worked with the virus in there, caught the disease themselves, passed it on to friends, family, and other people, and then it spread to people in Wuhan. I think the other possibility is that they got one of these viruses, they were studying this virus, there was an accident in the lab, and people in the lab got sick from the lab. So they didn't get sick from somebody else, but they got sick from something in the lab and then spread it to people in Wuhan. I think that's certainly possible. I think the other possibility is that they say that it may have spread on food shipped from places there. I think that's less likely. We're not seeing a lot of spread on food. And I think the last possibility is that the Chinese were doing something nefarious with the virus, trying to weaponize it or make a bioweapon out of it, and then it spread and it came there. I think that's the least likely. This does not look like a bioweaponized virus, although I guess anything is possible, but it doesn't look like a bioweaponized virus. So I think it likely started in animals, spread to people, may or may not have had some connection with Wuhan or one of the other institutes of virology, and then spread to people. But this tells us that many of the diseases we have now actually come from animals. So we think that Ebola certainly spreads in large mammals, apes, and then also spreads in bats. So there was an outbreak of Ebola that they think was caused by a fruit bat in Africa that was living in a tree, and kids were playing in a tree, and then they got sick from the bat droppings. We think HIV came from apes. And so there's a lot of disease that spreads between animals and people. And as people work with animals, especially exotic animals, there is going to be more spread. So, but the question on all of that, does any of it make a difference? Well, it'll be interesting and important to know where it came from. Whether it's going to make any difference with what we do now, I don't know. Another question that came up is, how well is the vaccine going to work against the variants? And we got some more data this week, and the data this week is that it works very well against the original viruses. Unfortunately, very few of those original viruses are still circulating. It seems to work very well against the B1.2, which is the one that had the D614 variant. That was predominant last summer and last fall. The vaccine seems to work very well against that. It even seems to work very well against the B117, which is the UK variant, and in much of the US, the predominant strain. It seems to work a little less well against the South African variant, which is a 351. It seems to work a little less well against the Indian variant, and I think data is still in the air about the P1, which is the Brazilian variant. The P1's been around a while, and yet we still don't exactly understand what's happening and why there's so much disease in South America when they've already had so much disease, and a lot of people should have natural immunity. And not exactly clear why it's spreading so fast in Uruguay, where they already have a lot of people vaccinated. So I think the variants are still the wild card out there, and I'm not sure how they're going to play out. The good news is that in much of the country that's done a lot of vaccine and a lot of disease before is really seeing historically low levels of disease. So this is about the best time ever in New York, and they're going to be opening schools and opening parks, and hopefully in the fall opening Broadway. So doing all of those kind of things to really get back to normal. In Oregon, our cases a little higher, probably because we're seeing some more of the B117 and the P1 variant. And so we're still a little worried, and especially worried now about the high level of hospitalizations. Right? So to have that many sick people in the hospital, for me is a bit worrisome. The other thing we've seen is a lot more disease in young people. So early on, we would have a couple of cases in people less than 20. We look now, we have dozens of cases in people less than 20. I think we had 5 cases today in people less than 5 years old. So there's a lot more disease in younger people, and I think places have seen that when especially the B117 variant comes into area. So somebody says, what variants are here in our area? So the variants in our area let's take Oregon overall, and then I'll do Douglas County. So overall in Oregon, we're seeing the B117. We're seeing some of the Southern California variants, the 427 and the 429. We're seeing an increasing number of the P1 variant, which is the Brazilian variant. We have not yet seen much of the Indian variant. In our area, we think it's about the same. We have a bunch of B117, some of the Southern California variants, and we clearly know that there's some P1 in our area, and this is a concern. So these are very complicated graphs, but when I look at these graphs, what you look to see which which virus replaces other viruses. So you would think that if viruses were out there, there'd be some of each, right? There'd be some of this and some of that and some of the next one. But what you see very clearly in this is that when a new variant comes and the new variant spreads better than the one before it, it rapidly replaces the one before. So when the variant with the D614G came, within the space of about 3 months, the old one was gone and all of this had D614G. In fact, I looked today, there is not a single variant I can find that still does not have the D614G. So it now went from 0% of the population last March to 100% of the population now. But they spread even quicker than that. And so what I'm always looking for is what's displacing what. In most places, B117 has displaced many things, except in places where the P1 and the 617 are there. And the P1 and the 617 seem to outmaneuver or outpace the B117. And that's a worry because remember, we think the P1 and the 617 are less able to be controlled by the vaccine. They have vaccine escape. And we worry about that here. However, when we look at people who've had these variants, don't seem to get sicker than before. So there was some concern that the variants might be more contagious and make you sicker. We're not necessarily seeing the and sicker, but I think what we're seeing is they spread a lot more and they're affecting young people more. So they're spreading more to young people. So you remember early on the disease was so heavily weighted towards seniors and very little disease in younger kids. We're still seeing disease in seniors, although most seniors are vaccinated, so we're not seeing much disease there, but we're seeing, I think, a more even attack rate between young people and old people. And that's a worry, because early on people said, I don't need to get the vaccine, I'm young and healthy. But I will tell you, some of those people who were really sick in the hospital would have said 2 weeks ago, I don't need this, I'm young and healthy. And now they are really critically ill. So if you've been thinking about getting the vaccine, get it. Going back to the question before, how do you talk to somebody who's really opposed? I think we don't want to. I think we don't want to alienate people. I don't think we want people to feel bad for the decision not to get the vaccine. But there's so many advantages of getting the vaccine. You get the vaccine, you can safely be with your grandchildren. You get the vaccine, you can safely be with others. You get the vaccine, you do not need to quarantine if you get exposed. You get the vaccine, you don't need to quarantine before you travel. So we had a family this week who wanted to travel to Hawaii. They hadn't got the vaccine, they got tested. Somebody in the family was positive. They couldn't go to Hawaii because they were positive, so they missed out on the vacation. Had they been fully vaccinated, they wouldn't have needed to do that. So that's a concern. Let's see, any more questions here? So one of the questions that came up with quarantine is, why do we have to quarantine for 14 days now? And this is one of the confusing parts of this pandemic. Early on, you had to quarantine for 14 days. In December, the CDC came out with 3 options for quarantine: 14 days, no testing; 10 days, and then no testing, and then monitoring for another 4 days; or 7 days with a test at the 5th, 6th, or 7th day, and then monitoring for the next 7 days. The state got rid of the last 2 options, and now the only option is for 14 days, which is a long time. I've been asking with the state for them to go ahead and fix that, but we haven't gotten there so far. Anyway, okay, that looks like it for the questions, and that's a good thing. You know, the hope is that we're going to be able to do this less often, less seriously, and really work on just getting more and more people vaccinated and have fewer and fewer cases. We're not there yet. We really need to get some more people vaccinated. So if you're thinking of getting vaccinated, Aviva is open every day, Monday through Friday. We're going to be at the fairgrounds on the 5th giving Pfizer and J&J vaccine. There are a bunch of providers in town that are giving the vaccine. So it really is easy to get the vaccine, and I'd encourage everybody to do it. And again, on this deal about fighting with parents and grandparents with us, I don't have any great advice here, but what I would say is we really need to be kind, and we really need to recognize that although this pandemic is important, although the vaccine is important, although objections to the vaccine are important, nothing is so important as to ruin relationships with your family. You only get one family. And so to ruin your relationships over something which in the end is not really all that consequential is to me quite worrisome. So as I've said from the very beginning, be safe and be kind. Now, Friday is the day before the Memorial Day weekend. Our staff has been doing this every Tuesday and Friday for a year, and this Friday they want to take the time off. And you know what I told them? Take the time off. So we're not going to do Facebook Live on Friday, but we'll be back again next Tuesday after rest and relaxation on Memorial Day, and we'll do this again. So again, no Facebook Live on Friday, but we're going to do it again next Tuesday. Again, if there's no more questions, Dr. Bob Dannenhoffer, be safe, be kind. Thank you.